Hello, welcome to another video. This video is going to be about mood and psychotic disorders. Sorry if I sound a little stuffy, because I am sick. So, okay, I don't want to, like, bore with definitions the whole video, but I'm gonna start out. Okay, so, a mood disorder is a psychological disorder characterized by the elevation or lowering of a person's mood, such as depression or bipolar disorder. And obviously, you could have just looked that up yourself. But, you know, I just kind of like want to talk about how hard these disorders are to deal with for some people. I mean, I don't necessarily know how they affect everyone, but they do affect people a lot. And a psychotic disorder would be, psychosis refers to an abnormal condition of the mind and is a generic psychiatric term for a mental state often described as involving a loss of contact with reality. And people with a psychotic disorder are the people you hear who are like who hallucinate or hear voices or have delusions. And a delusion is like an unrealistic thought, like everyone around me is plotting to kill me or something like that, to hurt me, you know. And it's a lot of like paranoia and anxiety I'm sure you get from those delusions. So I don't know if these are all of them because I don't know if this has everything, but some mood disorders would be major depressive disorder, bipolar disorder, or an older term would be called manic depressive, which manic is like elevated mood, and then depression is lowered mood. And then cyclothemic disorder, which I'm pretty sure that's the well, I can click on a little link here. It doesn't. Oh, okay. Okay, yeah. So it's like bipolar disorder, but it'd be like hypomania and hypodepression, which would be like not as bad. Basically, it's exactly what it is. And then dysphemic disorder, which is a chronic depression of mood lasting several years, but it's not like really severe. So I'm guessing it's kind of like the hypomania thing and the hypodepression, except just hypodepression, and it like lasts a really long time. Because I mean that would be like terrible to like have to go through that all. And then some psychotic disorders would be schizophrenia, delusional disorders, brief psychotic disorder, schizophrenia form disorder, schizoaffective disorder, and shared psychotic disorder. So, there's quite a few. Sorry. But these can really affect people. I mean, with mood disorders, obviously when you're depressed, I mean, you don't want to get out of bed. You don't want to do anything. If you're in school, you're going to probably end up getting bad grades because you don't want to do your homework. And if you're at work, maybe you're showing up too late or staying home sick because you don't want to leave. And with psychotic disorder, sorry, back to mood disorders, and if you have bipolar disorder and you are a manic, that can be really bad too, because you often make like sorry, I just got a text. You often make impulsive decisions like spending money you don't have, or having sexual intercourse with a bunch of people that you have just met. and it can be like really embarrassing afterwards and financially destroying. And with psychotic disorders, sorry, uh, obviously that can be bad if you're losing touch with reality. I mean, that's why most like people will like end up in mental hospitals and stuff. Not just with thought disorders or psychotic disorders, but I mean that is like people with those disorders may end up in like a mental hospital because they lose complete touch with reality and they're just like out of their minds. I mean, and even the mood disorder, the bipolar disorder, like they can have psychotic episodes if they're manic enough, and I'm pretty sure even if they're depressed enough, but it's still pretty bad. So, um, I think that's it for this video. I'm not positive what I want to do in my next video. Maybe I'll talk about personality disorders and eating disorders. I'll probably do that. And I'll just kind of like go through the list, and then I'll talk about them individually, and then add other stuff in there. So yeah, thank you for watching. I don't really have any like set day on how often I'm gonna make these videos yet, but we'll see how it goes. So if you want to see more of these videos, then please subscribe, and if you have anything you would like me to talk about or anything like that, then leave a comment, and if you like this video, then please like it, and yeah, so that is all. Bye!